On with us now, the Vice Chancellor of Health Affairs and the Dean of the School of Medicine at UMMC, Dr. LouAnn Woodward, joins us here on the show on the guest line. How are you this morning, Dr. Woodward?
Well, I'm doing just fine, thank you. I hope that you and yours had a happy Easter.
Well, aside from the weather, it was great.
I know it. The weather certainly did put a blemish on a lot of our state related to the holidays and just the weekend in general.
Yeah, but then that was layered on top of the thing that we've been going through for all these weeks now with the COVID-19 outbreak. It just made it probably one of the most, memorable, I guess would not be the word, but it's the only one I can come up with, Easter weekends that we've had in a while.
The kind of memorable weekend you don't want to repeat. Certainly
exactly.
Challenging and difficult.
Exactly. Now bring us up to speed where we are, in your opinion, from your perspective, with the COVID-19 outbreak here in the state of Mississippi.
So, we've been tracking the numbers as everybody does and watching both our own census in the hospital as well as across the state. And I do feel a little bit of optimism. Again, I'm a bit guarded to even say that, but maybe I'll say cautiously optimistic that I think some of our activities that we've taken as a state as far as the social distancing and people staying home have had an impact, have had the impact that we hoped in the way of dampening some of the growth of the cases as well as the deaths that we've seen in Mississippi. So I think that has been positive. I think the people in Mississippi should be proud of the response to that.
Well, and one thing, and I was talking about this during the last segment, part of the data that the State Department of Health puts out every morning when they put out their daily updates, they have a bar graph of the cases by date of onset. And it just, to me, looks like we're kind of moving downward on that a little bit. Am I misreading this?
Well, I think certainly what you're seeing is that bar graph does look like we're decreasing on that. However, you've got to keep in mind when the tests are resulted and those sorts of things. So 1 or 2 days doesn't make a trend, but it does look like we've seen several days, more than just 1 or 2 days. So again, I think the approach that we should take is cautiously optimistic. I don't feel like we are out of the woods or we should, have a celebration and a big public party at this point, but cautiously optimistic. It looks like things are trending in the right direction, and we just have to hang tight and see if these data points continue and it really does turn into a trend we can trust.
Well, and that's the thing to me is it's all about momentum. And it looks like right now we have momentum on our side going in the right direction. But as soon as we ease up, we could find ourselves in a bad situation. That's why we have to keep concentrating on doing the things we've been doing this whole time to get us to this point, right?
I think that's right. And, there's an eagerness and a pent up I think, readiness for things to get back to normal. And that's not going to be something that can just happen with the flip of a switch. And it's not going to be something that, we don't want to prematurely do that. We, of course, don't want to, we don't want to wait any longer than we have to. But I think right now it looks like the numbers and everything is heading in the right direction. And that is a result of the good work that people have done and the fact that people have been willing to do the social distancing and to stay home. And so it's that we've got to find that right balance. But certainly things are moving in the right direction, and we don't want to see it turn for the worse.
Well, and the danger was always there. It was said from the very beginning that the best case scenario was for us to reach a point where everyone says, oh, it's not that bad. We overreacted. We did way too much, and losing sight of the fact that it was the reason for us doing so well is that we took all of those steps.
Exactly. If I told my team several times when we were first, starting to do the steps of restricting visitors and cutting back on surgical cases and canceling clinic appointments and all of those things that nobody wants to do. The message I gave them was, in the end, if people say we overreacted, then we were successful.
And that's a hard thing to see, Dr. Woodward.
It is. It's hard to see when people When people want to be out and they want to be doing things and businesses want to be open and people want to have that knee replacement done that they've been planning on for, 6 or 8 months, it is a very difficult thing to do. And then you have to realize the financial implications that go with that. Everything from the hospitals and health systems, which everybody in the state is seeing, but also all the other businesses and people who've lost their jobs. So it is not an easy decision or an easy equation at all.
And I've been saying that for several weeks now. I have never in my life been happier to not be an elected official.
I know. I would agree with that statement. My goodness. They're in a really tough position right now, having to balance a lot of very important issues.
Well, and that's the thing. The way I've been describing it is it's like one of those old-timey scales with the two platforms on either side. You do something on one side, it affects the other side. You've got to find the balance in there somewhere. But the problem is, in this situation, you have to find the balance, but all the weights are changing on a daily basis on both sides, so you have to correct continuously. It's a monumental Herculean task.
It really is. And I've heard a lot of people saying, well, we should have done this and we should have done that. And it's so easy to go back and, look in the rearview mirror. It's so easy to say what we should and shouldn't have done. The fact is, none of us have lived through a situation like this, a pandemic like this. This is uncharted territory, and based on information that is, in fact, changing daily, we're all just trying to make the best decisions that we can.
Well, and that, to me, is the challenge, but in a way, and this is going to sound weird, Doc, it's almost a blessing because we're not falling back on a plan that was designed for something else that might not be what we need now. We're having to react directly to what's going on instead of doing things, quote unquote, the way we did them before. And I think that may actually wind up being an advantage for us in this situation.
Well, I think, in the heat of the moment, it doesn't feel like we have too many advantages, honestly. But what it is doing is it is forcing us to think outside the box. It is forcing us to, for example, use telehealth a lot more even than we already were. It's forcing us to think about how we can use technologies. Here at the medical center, for example, we are having a drive-through area where we're doing lab testing for patients who, for whatever reason, are on certain medications like blood thinners or their, whatever their situation may be, and we don't have the luxury of not drawing that lab and monitoring them and being sure they're safe. So we've got a drive-through lab set up. And, it may well be that when this is over, there are some of those pieces that kind of fall in the silver lining category, and we decide, this was really great. It was efficient. It worked well for the patients. Patients liked it. Maybe we need to continue some of these things. So we are learning a lot. I think it does highlight the need for all of us here at the medical center and just across the state and across the country that we really need to be prepared at all times for whatever might come. I certainly hope this is a once-in-a-lifetime pandemic. But, you listen to the infectious disease experts and the epidemiologists out there, and I'm not sure we can check that box. I think we have to, as soon as we can catch our breath from this, think about and prepare for the next round of whatever this might look like.
Now, to be fair, the infectious disease doctors as a group, usually not the life of the party.
I would never say that.
Well, you wouldn't. That's why I said it for you. I've tried to provide you a buffer here, but come on. They're the guys standing over by the punch bowl explaining how many microbes are in that ladle full of liquid you just put in your little plastic cup, and it just kind of turns you off. So, yeah, I get that.
And, as a former microbiologist, that was my undergraduate degree in college. So I have a microbiology degree, and I can tell you, I think there's some truth to what you're saying there, but boy, our microbiologists and our pathologists and the infectious disease and infectious prevention teams, right now, they are the rock stars.
Well, that's the thing. They might not be the life of the party right now. They could be the life of your grandma.
That's right.
I mean, dead serious guy. Can you hang on through the break? Come back. SuperTalk, Mississippi. Dave Hughes, and on the phone with us, Dr. LouAnn Woodward with UMMC. And Dr. Woodward, we were talking about the trends going possibly down, and we're using all of these words to kind of hedge what we're saying because we've seen it before in this process already, where we had a day or two where the numbers were down, and a lot of people jumped on the bandwagon and said, "Oh, see, it's over." And then another day would come along, and we would have a huge number. So 1 or 2 days even 3 or 4, don't necessarily mark a permanent trend in any of these numbers, do they?
That's right. That's right. We just need to hold tight and kind of keep doing what we're doing and monitor things closely. But I would say that we're not going in the wrong direction. It looks like, again, my phrase is cautiously optimistically, that we're seeing some positive numbers, and hopefully it turns into the kind of trends that we want to see.
Well, and that's what we're shooting for, obviously, and we're shooting for a return to normal, if you will. And let me ask your opinion on this. Just full 100% normal, like it was in December, okay? How long will it take us to get back to that point, or will we ever 100% get back to that point, in your opinion?
That's very hard to project, and it's in part because everybody has a different view of normal. So when we get to the point where schools are open and people are kind of going about their usual business, I think a lot of that kind of return to school and everything will happen either over the summer or certainly in the fall. But when you think about healthcare and you wonder, okay, what is the normal now? My gut tells me that the hospitals and the clinics and the physicians' offices will be ready to return to normal, somewhere in the probably next runway of 4 to 8 weeks, probably closer to somewhere in the middle of that, 6 to 8 weeks. But I predict that the patients will be a little bit reluctant. I mentioned earlier somebody with going to have their knee replaced, and they've waited now 6-8 months. They might think to themselves, I'm going to wait a few more months. I'm a little bit hesitant to go back into a healthcare setting. So, that's hard to predict, but I think we may even be up to 9 months to 12 months away from things really feeling like normal. Now, having said all that, there are some people that think we may see another spike of coronavirus in the fall. So that, of course, would have an impact if that is, in fact, true.
Exactly. And it goes back to what we were saying in the last segment that's been true for this entire situation. It's a continuously moving target. That's why it's so hard to give any firm estimates or anything that you have a whole lot of confidence in, because what's true today, well, it's Monday. By Friday, we may be dealing with an entirely different story.
And we've seen that over the course of these last couple months. We've seen that multiple times where, in fact, that's what happened. The information changes, and you're kind of chasing a moving target. A lot of these things are projections and models, are not solid. They're not concrete. They're not things we can completely rely on. But everybody's trying to put kind of their best data and their best educated guess, if that's the right word. It's really not a guess, but their best educated speculation into it to give us that guidance.
Well, and I kind of relate it to the weather situation we had yesterday, and here's what I mean by that, Doc. We have advanced so much in the way we can predict the behavior of weather, and we know days in advance it's going to be bad. We know that we have problems coming. We have computer models running for meteorologists that have millions of points of data that they use to determine all of this. And then it gets here, and yes, it was right, but they still couldn't predict exactly where or exactly when or exactly how long or exactly how strong. So in general, you can make some pretty good predictions, but as far as the specifics, like, you get questions all the time. When am I going back to school? I don't know.
Right.
That's
a good analogy. It's hard to pin down the specifics.
Well, you feel horrible giving that answer. You feel like you're kind of dodging it, but you're not. That's literally the answer to so many things right now is, I don't know. That's the honest answer.
It is. we are a couple of the things that we're working on here at the medical center to try to help in some way of getting people answers. We have, I talked to you, I think, last time about our internal testing capacity, and we're at a point now where we can run almost 500 tests a day, and later this week hope to be up to the point of 600 tests a day. So we're working with some of our local partners, some of our local hospitals and health systems, the Department of Health, and reaching out to some others so that if they need help with testing, we can provide some of that. We're trying in every small way that we can to give some of those definitive answers and to give people back information. And I think that helps when you're able to get your questions answered quickly about the patients you're taking care of, whether or not they've tested positive.
Well, and that's an important part of this entire thing is that we've been dealing with a delay. I've heard reports of anywhere from 3 to 8 days from the time you get tested until you get the results back. And that's just too long. If you go in today and get tested and you don't know until next Tuesday whether or not you're positive, it's really hard to manage this properly, isn't it?
It is. And for the patients that are hospitalized especially, that means during that delay period of when you're waiting to get a test back, if the test is negative, you may have spent 3 or 4 days taking care of that patient, not knowing, and thereby burning up this PPE, which right now is so precious and so hard to come by. Another thing that I just want to share with you, kind of on the standpoint from the medical center, our news right now is we started last week a respiratory clinic. So we've got a number of physician practices in our clinics that are closed right now, but yet they still have patients that belong to those practices and clinics that feel that they have some symptoms and maybe they need to be seen. They may not be sick enough that they really need to go to the emergency department, but yet they need to be seen. So we started a respiratory clinic last week, and that has gone very well. We feel like we've worked out the kinks, and we'll be opening tomorrow that respiratory clinic up to the public so that if patients in other physician practices are in that same position where they have some symptoms and they feel like they need to be seen, there'll be a way to call in and to be screened for that and then scheduled an appointment in the respiratory clinic if that's something that would be helpful. Just to give another avenue for people who right now may not be able to get in to see their regular primary care doctor, to give them an avenue to have somebody lay eyes on them and take a look at them and evaluate them.
Well, there are a lot of fantastic things coming out of UMMC. On a personal note, has anybody started giving Dr. Robertson Lowe's gift cards? Because that was incredible what he did.
It really was incredible. And the way he has couched it is he has, of course, is an anesthesiologist and works with ventilators all the time and has spent a lot of time thinking about, okay, just the bare bones. What would it take to make a ventilator that doesn't have all the bells and whistles but would work in an extreme situation if you were literally faced with the choice of compassionate care versus being able to put a patient on one of these ventilators? And through our research lab as well as our simulation lab, he and several members of his team probably spent 2 or 3 weeks testing this thing, and it's really amazing the work that he has done and the way that this ventilator can perform, particularly being made out of the parts that it's made from. It's really highlighted some creativity and some innovation, and I think just what I love to attribute it to that Mississippi ability to be resourceful and to get things done, sometimes under less than optimal conditions.
Well, the best way I've seen it put was on social media. They said, if you want something done, send a Mississippi boy to the hardware store.
There you go. I love that.
It's going to happen. That was so fantastic. I'm sure he has heard this already, and you have too. I'm just wondering if it's being used internally. Is he now amongst the staff known as Dr. MacGyver?
Well, that's not official, but, a few people have made that reference.
Yeah, well, somebody needs to get him a T-shirt printed or a plaque or something because that deserves an attaboy. Dr. Woodward, I always enjoy talking to you. And, all we can do now is just buckle on and buckle up, hold on, and get through this and finish as strong as we started. We've been comparing it to a football game for a long time, saying we're not to halftime yet. We're in the first quarter. Well, you got to play all 60 minutes, and that's what we need to do.
We've got to hang tight and stay the course.
Fantastic. Dr. Woodward, we appreciate it. Keep us updated on what's going on over at UMMC, okay?
I certainly will. Thank you so much.
Dr. LouAnn Woodward.